Gladu, what do you think about a 16-year-old voting age? The NDP is pushing for this. There's a bill or motion before the House today. What are your thoughts on this? Do you think 16-year-olds should be able to vote in federal elections?
Well, I certainly believe in informed voting. I think the rest of the ages that you can join the military, that you can drink alcohol, for example, are older, and so I think we should stay consistent with that.
So you think 18 should stay there?
I think that should be the age.
So you'd be voting against this?
Exactly.
All right. Well, the argument is that this is their future too, right? And within the period in between two elections, they'll become voting age, but they won't have a say in what happens. So
well, and I've certainly seen young people very active in my own campaigns. I encourage that. But in my household, until my kids started paying the bills, then they didn't get a say. Thanks.
Roxham Road, Ms. Gladu. Bonjour, Sénateur Boisvenu. Je peux vous poser une question sur le chemin Roxham. On fait quoi? Chef conservateur du Québec ne rejette pas l'idée d'un mur. Est-ce que c'est une solution, selon vous?
La solution, c'est de faire en sorte que l'immigration soit légale partout au Canada. C'est pas normal qu'il rentre autant de gens de façon illégale que de façon légale. Puis moi, j'ai des gens qui m'appellent presque toutes les semaines à mon bureau, demander d'intervenir sur des gens qui veulent faire venir au Canada puis qui attendent depuis des années. Je pense entre autres d'un ami là, qui s'est marié avec je pense c'est une Dominicaine, puis ça fait 2 ans qu'elle attend de ramener sa femme ici. Puis quand ils voient ça, que les gens peuvent rentrer facilement de façon illégale, c'est décourageant pour eux.
Fermer le robinet, justement.
Moi, je pense qu'il faut fermer Roxham, puis il faut gérer notre frontière comme on gère partout à travers le Canada.
En fait,
on met la sécurité. À la limite, non. Moi, je pense que les murs, c'est d'un autre monde, d'un autre temps. Mais je pense qu'il faut mettre de la sécurité éventuellement.
Donc, empêcher les gens. Parce que dès qu'ils traversent la ligne.
Il faut fermer Roxham. Il faut fermer Roxham.
Ils traversent la ligne, ils sont au Canada, il faut qu'on les prenne. Donc,
si je vais aux États-Unis, là, puis je passe par la forêt, puis ils vont faire quoi? Ils vont me ramener au Canada ou bien ils vont me juger comme entrée illégale. Pourquoi qu'au Canada, on permet ça encore?
Le gouvernement dit souvent que si on ferme Roxham, c'est que ces gens-là vont tout simplement trouver une autre voie, probablement moins sécuritaire, vont mettre leur vie à risque.
Mais si c'est des vrais réfugiés puis qui passent par les voies normales, on va les accueillir. On a accueilli les Ukrainiens, on a accueilli les Syriens par les voies normales. Ils n'ont pas passé par Roxham, ces dizaines de milliers de personnes-là. Donc, s'ils passent par un lieu réglementaire puis qu'ils se disent réfugiés, on va les accueillir.
Ben non, parce que c'est ça l'accord des tiers sûrs. S'ils arrivent des États-Unis, il faut qu'ils retournent aux États-Unis.
Oui, mais s'ils sont vraiment réfugiés puis ils font la preuve que leur vie est en danger, on ne retournera pas.
C'est pas ça que la loi dit.
Non, je comprends, mais en principe, on ne retournerait pas si vraiment leur vie est en danger. Parce que si quelqu'un nous arrive d'un autre pays, je ne sais pas, l'Amérique du Sud, puis qu'il démontre que sa vie est en danger, puis à cause d'un système, je ne sais pas, mais un système politique qui ne reconnaît pas les droits des femmes, qui ne reconnaît pas les droits des gays, puis cette personne-là dit « Moi, je suis retourné chez nous, on va m'assassiner », le Canada ne le retournera pas.
Bien, s'il passe par les États-Unis, oui. C'est ça l'entente sur les pierres.
Moi, je pense que dans ce cas-là, revoyons cette entente-là.
OK. Vous trouvez que
Puis ils ont plus de souplesse quand ils passent par les voies normales.
OK.
Moi, je pense que c'est demain qu'il faut gérer ces gens-là de façon humanitaire. Mais ce que je dis, c'est que c'est pas normal qu'on ait maintenant presque une industrie de passage, puis que les gens qui sont légaux, qu'eux vont attendre des 5, 6, 10 ans avant de rentrer au Canada.
Est-ce que, il y a des reportages sur le fait que les terres autour de là sont possédées par des libéraux, et donc c'est eux qui obtiennent les contrats. Vous, est-ce que vous faites un lien de causalité?
Moi, tout ce que je dis, si on a vraiment dépensé 500 millions dans ce secteur-là, il faut savoir où on l'a dépensé. Ça prend la transparence. Voilà.
Merci beaucoup.
Allez, bonne journée à vous.
Merci.
Au revoir.
About vaccine mandates for the military, we saw Mr. Poilievre say that they should end, but it's a very complicated, nuanced issue. They did go into nursing homes.
Yep.
In during that time, they have to go overseas where potentially they may need a mandate. So, can you give us your thoughts on that?
Well, I think it's important that that the operational requirements of the Canadian Forces, need to be weighed. There's different vaccination requirements as a conditions of their employment, but with respect to COVID-19, we've seen that the the state of COVID, of the pandemic in Canada is such that every provincial government has done away with their vaccine mandate. The federal government has done away with it. So if there's a specific operational requirement, that's one thing. But I think that just as a condition of their employment, that like anyone who works for the federal government, that needs to be eliminated.
Can I ask you also about the military taking part, you know, in natural disasters? Should they be more focused on overseas missions rather than focusing so much on these types of natural disasters?
Yeah, you know, it's important that we have an ongoing review of the operational capabilities of our Canadian forces. The number one job of our military is to defend us against threats on our shores and you know, in defense of our allies and global peace and security. So that's job one. I think that members of our Canadian forces, with pride, execute on missions, you know, the Op Lentis type missions that see them offer forest fire, flood, and disaster assistance relief. That's an added benefit that we get from our men and women in uniform. We're really blessed by their service, so I want to thank all of them for what they do. But it's a question about capabilities. The Canadian Forces is struggling with recruitment, and first things come first, and they need to be able to do that at all times. And you know, if the provincial authorities need to supplement the capabilities of the Canadian Forces because they don't have the manpower to deliver on disaster assistance relief, then that's something that would need to be looked at. But yeah.
I just want to go back to your position on the vaccine mandates for military. Am I correct in understanding it's not a carte blanche? This requirement should be dropped for everyone versus it should be seen on a case-by-case basis because it is a little unique in the military?
Well, as I said, there are different vaccination requirements for members of our Canadian Forces based on where they're deploying to. And you know, they're required to be operationally ready. So vaccinations against diseases which aren't on our shores are sometimes required for Canadian Forces members before they deploy. So it's a big question what's required. The initial series of 2 doses for COVID-19 has been deemed safe for folks to stop at that because we're not continuing with vaccine mandates. The same should be true for our Canadian Forces soldiers, and unless there is some kind of extreme circumstance that would require a third dose, then the same rules should apply to members of our Canadian Forces as do to other federal government employees.
But just to understand, are you saying that if they are deployed, then it could be okay to ask for an extra dose or a requirement of vaccination, but if they're not, then there's no need to keep that as a condition of employment?
Well, it certainly should not be. So let's be clear. The COVID vaccine should not be a condition of employment for anyone.
Okay.
We're at a point now where, and the minister has been clear that his use of, to use his word, coercive measures are no longer effective. They're not going to. Anyone who hasn't received those that first series is unlikely to be motivated now by you know, a mandated requirement. So I think that you need to put that away. But it would require, I think, an extreme and a stated you know, operational requirement, as is the case anytime any extra vaccinations are required for members of our Canadian Forces.
So in some circumstances,
but just in the
it could be
in the hypothetical, it could be, but not as a rule of thumb. Not deploying to most European countries, which is where, you know, our Canadian Forces are going now. There's no public health case that we've been made aware of.
And
that would be
2
required.
doses, or maybe 3 or even 4?
I think that right now the requirement is that they're required to deploy to have the primary series, dose 1, dose 2. Mm-hmm. I think that's it. And unless a public health case is made by the chief surgeon for the Canadian Forces on why that booster, which we know its efficacy wanes after 6 months, if they got their booster in December and the science tells us now that it's no longer offering them any protection, well, are we just doing it for the sake of doing it? That's an important question. So unless there's a specific requirement that would, and in the absence of that third dose, would compromise operational readiness in a meaningful way, then more than any gastrovirus or the flu, then we ought not continue with vaccine mandates just for the sake of vaccine
mandates.
Can I
just ask you about dental care, the prestation, the checks that the Ottawa wants to establish? So do you have a more precise point of view on that now as a party?
Yeah, it's not a dental care program. And the federal government ought not be delivering healthcare services, certainly without having had a conversation with the provinces, and they haven't done that. So when we're in a situation where the premiers have asked for the Prime Minister to meet with them for 2 years and to discuss healthcare transfers in the state of healthcare in Canada, and the Prime Minister has refused to do that, and then the premiers have responded to this commitment with respect to the NDP coalition agreement on providing dental care. The premiers have said that they're not asking for that. What's more, 70% of Canadians have private health insurance, and all of the provinces and territories, save for 2, have dental supports for low-income children. So what is it that the government is trying to achieve here? If they want to deliver targeted support, in the 2 provinces that don't have it, in collaboration with those provinces, okay, well, that's a different conversation. Again, this is very, very much a naked power grab by the government when there's no case been made by the provinces, who have all kinds of other concerns with health care.
You said it's not a program, it's really just checks.
It's checks.
On the basis of that, do you have some fears of abuse or throwing out too much money? Do you have concerns about that?
I'm concerned about the federal government abusing the taxpayer dollar. I'm concerned about the effect, the inflationary effect of the government just printing more money to pay for programs that aren't addressing the most pressing needs that Canadians are facing. And frankly, that's the cost of living crisis that we're dealing with. We have 4 in 10 Canadians who are modifying their diets so that they can afford to go grocery shopping. They can't afford to fuel their cars, and we're on the verge of the winter season in one of the world's coldest climates. And the government is not taking meaningful steps to address inflation across the board. So this program is not one that's being done in collaboration with the provinces, and we don't support it.
You mentioned 2 provinces. Which ones are there?
Manitoba and the Northwest Territories, I believe.
Okay, thank you very much.
Okay, great, thanks. Have a great morning.
What do you think about... Oh, sorry, go ahead.
I'm just going to change topics a little bit. Should the military drop its vaccine mandates?
Yeah.
How come?
It's dropped everywhere else.
What do you make of the fact that it has not yet?
It sounds like a political decision, not a science decision.
How do you know that?
I don't know that. I'm just you're asking me my impression. That's my impression, right? So, no, there's lots of brave men and women in the military that some choose not to be vaccinated, some choose to be vaccinated. That's their choice. That's the same choice that people have right across this country. You have to respect their choice. That's part of the freedom they want to live here in this country, so we have to respect that.
What about 16-year-old voting age? The NDP is pushing for 6. Do you support that at all?
Personally, myself, I don't support that.
Why not?
You can't buy a beer at 16, so why should you vote at 16? Would be the quick answer I have for that. But again, I haven't put a lot of thought into it. So, personally, I'd say no.
Do you think you should be debating the carbon tax when there's issues of climate change right now with Hurricane Fiona?
Well, there's climate change, but let's talk about real issues. Real issues is, can I afford this coffee? Can I afford to buy diapers for my kids? Can I afford to buy food? Am I going to go to the grocery store and buy fruit, or am I going to buy something that's cheaper? Those are real hard issues. There's natural disasters happening all the time. And those are important too, and climate change is important. But right now, if you can't feed your kids, what are you really looking at? If you can't go to the grocery store, I've got to choose now between what do I get versus talking about other issues that are important issues, but you have to prioritize. And right now, the most important priority to Canadians is, how do I pay for the food that I need to put on the table? How do I get the diapers for my kids? How do I get milk? Do I have to put water in my milk? Those are the questions you need to be asking right now, because those are the priorities for Canadians.
Natural disasters are going to affect Canadians across the country related to climate change.
I agree 100% with you. But I'm looking at the fact that you've got voters right now, people in my constituency, that are looking at the natural disaster and they're worried about it. No question about it. But in the same breath, they're trying to just feed their kids. They're trying to feed their kids. So you think, I don't want to display the natural disasters. I don't. But the real issue right now facing my constituents is, How do I feed my kids? How do I afford to put food on the table? How do I do that? You could, possibly, yes. I'm not saying you can't. But you're asking me to prioritize one over the other. That's what your question was. I'm saying right now the priority has to be on basic Canadians being able to meet the requirements of actually having a life. Basic life. Basically going to be able to buy food for their kids. And if they can't do that, how can they focus on other issues? How can they focus on homelessness and everything else that they also think are important issues?
But isn't debating removing the carbon tax not focusing on climate change and natural disasters?
See, then you don't understand that. The debate on the carbon tax is actually trying to lower the cost of goods and services for Canadians so that they can actually afford to buy things. That's the debate. It's not a climate debate, it's a debate on affordability. You keep on tying carbon tax to the environment, and that's fair. That's one theory on how to tackle climate change. But it's not the only way to tackle it, and it's a way that actually hasn't been showing a lot of results when you look at the results right now from the PBO. It hasn't had the impact that they expect to have. We had high fuel prices this last summer, super high fuel prices. Did it reduce consumption? No, all it did is reduce the size of their wallet. It did not reduce consumption. Because if you live in rural Saskatchewan, you have to go get groceries, it's an hour drive. I need groceries today, I need groceries next week. It's still an hour drive. I still have to buy those liters of gas. So if you want to look at what you can do to help Canadians, carbon tax is one of the things that they definitely could look at and say, hey, let's get rid of it, or at least stall it. Let's at least hold the ground. Let's at least keep the original commitment of $50 a ton, rather than just keep upping it up and upping it up, and then all of a sudden you have people sitting there saying, making that decision. Am I going to put water in the milk for my kid? I'm going to buy milk for my kid? I'm going to buy diapers? What am I going to do? Because those are real issues to Canadians right now.
But Canadians have voted for a carbon price, which the Supreme Court says is for the past two elections. So isn't this kind of a dead issue a little bit? Like it's done and over?
There's realities of today versus realities when we were voting a year ago. Look what was going on in the economy a year ago. COVID was the main reality, right? We're talking COVID, what we should do around COVID. The economy was not the priority of people's futures. Inflation was not a factor a year ago. Inflation's a huge factor right now. So you have to adjust your policies to realities of today. You can't take your mandate from a year ago or 2 years ago or 5 years ago and say they still apply today. That's like taking mandates from Stephen Harper in 2008 and say they still apply today. They don't. You have to sit and talk to your constituents and listen to them and say, hey, this is what's going on in my riding. I need help. And if you can't listen to that, if you can't hear that, then you're deaf. I think I better stop there. I might get more emotional.
Thanks,
anyways,
thanks very much for stopping.
Thanks for helping. What do you make of what they need?
Well, in Nova Scotia, it's slowly getting better. We got power back at my house last night, so that's the first concern for me and my family. So my riding wasn't hit as hard as some of the others because I'm in the southern part of Nova Scotia, and it's sort of the middle to northern part of Nova Scotia that got hit worse, so up around Cape Breton and Cumberland, Colchester, Dr. Ellis is riding. They were hit hard. There's still a lot of trees down. I don't think there's enough military support right now. After Hurricane Dorian, within a week there were 700 soldiers 3 years ago in Nova Scotia helping clear trees. Right now there's 100. So I think there can be more done to help clear those lines. The Nova Scotia Power needs more assistance in clearing the trees. My street alone, which is only 30 houses, had 40 trees down on power lines. So it took quite a while for Nova Scotia Power to actually have to cut those trees before they could replace all the power lines. So I think that's the most immediate thing, is getting power back, because in my riding, for example, the hospitals can't do MRIs. I have had a woman in my riding who had a stroke, and when they brought her into the hospital, they didn't have enough power to run the MRI machine to try and deal with her treatment. So those are the things that not having enough power is causing. They're running on backup generators. This is a harvest time for grapes. We have a big grape and wine industry through the Annapolis Valley and up on the North Shore, and because of the power issues, they can't harvest the grapes, which are supposed to be harvested now, and they've already lost 20% of the crop due to the winds have fallen on the ground. So there's a lot of work related to getting power going still. That's the main challenge. Of course, as a fisheries critic, PEI and Newfoundland have been very hard hit on the fishery, as has southern New Brunswick. They've lost a lot of fishing gear, and in PEI in New Brunswick, they're in the middle of towards the end of the lobster season. So losing a critical month of fishing is going to mean a lot of people are going to be short of their income that they need to survive for the year unless we can get them back out in the water with some new gear.
Can I ask you about, sorry, you mentioned that there's not enough military there right now. One of the things, should the military be focused on natural disasters or should they be focused on overseas conflicts?
Well, I think the primary role of the military, and I've got family that are in the military, and most people join the military because they want to deal with the operational defense needs and helping NATO and overseas operations, and they're not well enough equipped to do that in a lot of cases. But when we have troops, because we always have troops, so 2/3 of people that are in the military come from the Maritimes, and we have a lot of people on the bases already there that aren't being utilized that could be deployed fairly quickly to help in an emergency situation. So I think if we have the capability and the troops at home, and it doesn't harm the operational needs abroad, then we should utilize them for natural disasters, which we're facing now.
Should Canada focus maybe on something like a FEMA in the United States?
That's an interesting.
Down the road.
That's an interesting question because they do deploy some of their natural things, like they call up the state guards and that kind of thing to help out under FEMA when they have natural disaster. I think our emergency services, police and fire, are doing all they can, and that's why we need to supplement them with that. Emergency preparedness ministers, both federally and provincially, sort of fill that role a bit. I spoke yesterday to the emergency preparedness minister for Nova Scotia, John Lohr, just about where things are at, and I believe he's putting in another request for more troops to help. And to some extent, the federal government, like in both Canada and the U.S., are limited that they need that request to come from the provinces before they can really do that. And so it's incumbent on the provinces to push for those resources.
Are you concerned that your constituents may view your party as being tone deaf, and the fact that they're speaking about removing the carbon tax again when you're being inundated with a natural disaster caused by climate change? Like, do you worry about that?
No, because what I hear from my constituents is this is the last thing they need on top of the rising costs that this will cause. So they have to buy new fishing gear. I'm the fisheries critic, so they have to buy new fishing gear. All of that has a tax. The last thing they need is a tax on top of a tax that forces the prices up when they're trying to deal with the disaster. It's actually probably the worst time to try and impose a new tax, as we don't have a carbon tax in Nova Scotia, but the Prime Minister wants to impose one. So I'm here, number one thing I'm hearing from people on top of the natural disaster is how they can't afford more taxes.
But your constituents do want something done about climate change?
Well, fishermen are the ultimate environmentalists. They've been fishing in my riding for 300 years. They want the industry to be sustainable for future generations. They know more about what's going on in the water than the government does in terms of what's happening on climate change. But in Nova Scotia, we've managed to exceed all of the targets the federal government has set on climate change. We've achieved the 2030 targets 13 years early, and we did it with technology, not with taxes. And so there are other ways. The obstinance of the federal government in saying that the only thing that can achieve carbon reductions is a tax, and every year they've missed their target, and our carbon emissions goes up in Canada, yet they're going down in Nova Scotia. So I think Nova Scotia can provide the model for this federal government if they would only listen.
What solutions are you proposing, and have you brought it up to the party, and are they going to adapt it into their own?
I raised it. I talked about it in my speech on the carbon tax yesterday in the opposition day. I outlined what the province has been doing for the last 20 years on carbon.
Can I just ask you one quickly on carbon tax and what it's like for East Coasters who have to pay, oil bills? I know my mom in a house, it's expensive. What type of costs can they expect?
Yeah, over 53% of Nova Scotians have to heat their home with oil. We don't have natural gas pipelines at our houses in Nova Scotia, and the oil we have, because there's no pipeline, comes in tankers to St. John, New Brunswick from Saudi Arabia and gets processed. So I heat my house with oil. It's my only choice, oil or electricity, and the electricity we generate is 60% generated by coal that comes from Colombia. So that is being reduced, but we have to find a way to get off oil. It's very costly in terms of the carbon tax. Starting from zero carbon tax to going to the tripling by 2030 is going to add 40 cents a litre to home heating. Right now, it costs over $1,000 to fill an oil tank. So it's costing the average Nova Scotian about $3,700 a year in the winter to heat their home. with oil. On top of that, you put a 40-cent tax. I've been contacted by constituents, particularly low-income constituents. One in particular, she's on disability, getting $875 a month, and she does have a house that she inherited from her parents, and it costs $700 a month for her to heat the house with home heating oil, which leaves virtually nothing left just to buy food, let alone get in a car because it's rural. We don't have public transit to go buy groceries. So these are the choices that people are having to make, and they're having a difficult time understanding why at that time and with their situation they'd have to pay more for home heating oil because of a carbon tax that doesn't work.
Thanks so much for your time.
Thank you.
Okay, first of all, thank you for stopping. But I just wanted to get your sense of, first of all, the disaster relief efforts in Nova Scotia. What could the government be doing more? Are you satisfied with how they're handling it?
Yeah, that's a great question, Judy. Actually, I just had an opportunity to speak with Premier Houston just moments ago. His big ask is, he's already asked for the military to be there. His big ask is for more help. We know that there's still people there without any power. We know that there's a lot of trees that are down, and the people like the military are really good at helping out with respect to that. And I think that would mean a lot. We have a long-standing history of being people who've served in the military in Atlantic Canada, and I think seeing the military there would be a great comfort to people of Nova Scotia for sure. And as I said, that's exactly what the Premier wants to see as well.
Okay. Can I get also a sense? I'm trying to understand why it is that the Conservatives, given your push for the common person, the cost of living, why is there such a pushback on the dental plan for low-income families?
I think there's a few things with respect to that, Judy. We know very clearly that many of the jurisdictions already have dental care programs. And I think the other more obvious answer, though, is really related to the fact that we know that this government isn't delivering on basic health care for Canadians. We know that this government is also not very good at running government programs, so to ask them to create an entirely new program is really without precedent and absolutely ludicrous in my mind to ask them to create another program in which they can't even administer a long-standing program like medical care for the basics for Canadians. That's the biggest issue we have with this.
But Dr. Ellis, you know as a doctor that dental care is medicine, is health care. And there are some concerns that perhaps this is a hypocritical position because Conservative politicians, along with other politicians, get $2,000 in benefits a year as part of the national program for the public service.
Yes, absolutely. And we know that there's a multitude of other people who have private dental coverage as well. When I speak to the dental associations, one of the things that they say is that for the federal government to administer this is absolutely wrong. What their suggestion would be is to have a look at what the provinces are doing at the current time, and then how can we actually make that better. But pressing for a federally administered dental care program, really not acceptable. And again, I would press this government to actually look after Canadians with respect to their physical health such that they all have an access to a family doctor.
And how do we improve on that?
Again, it's a significant problem. One of the problems that we've heard is the Prime Minister promising in the last session, 7,500 new physicians, nurses, and nurse practitioners. We know that there's been absolutely no talk about what's happening. We have some great ideas on policy here in the Conservative Party, how we can improve that going forward. And I think that as we get closer and closer to the election, you'll see that policy rolled out as part of our platform. And we look forward to doing that on behalf of Canadians.
Do we need to fund medical positions, residencies in universities? Where is the backup exactly? We say we need more doctors, more nurses, sure, but yet we can't get them out.
I think the Canadian Medical Association under Dr. Catherine Smart has put out a reasonable roadmap with respect to that. I think that we need to listen, let's be honest. This is a crisis and nothing more. I mean, in my own province of Nova Scotia, there's 1 million people without who live there, of course, and there's 100,000 people without access to a family doctor. Well, we know that getting people into medical school takes a long time. Getting them through the residency takes a long time. We need a full court press with respect to looking at credentialing of international medical graduates as well. That's going to be a significant part of how we're going to get people into the system more quickly.
Thank you, Dr. Ellis.
Thank you. Appreciate it.